this hour's going so quickly, and I must now quickly bring in Patricia Gillen, because otherwise we'll run out of time. So, and Patricia's come in from Northern Ireland, and I think the screen is yours.
Delighted to be here, as Sue has said, and I'm here to talk to you about some research. And I think, as was said at the very beginning, I am passionate about looking after our staff. Having been bullied as a midwife, having left my job as a result of being bullied, I have remained passionate about how we need to look after each other, how we need to care for ourselves and each other. And any opportunity to look at the culture of work, to look at how we can care for our staff, what about the well-being of our staff, I'm in there, I'm delighted. So last year, I had started to work with a group of colleagues. They're from a range of universities across the UK. There's ourselves at Ulster, Queen's University in Belfast, Bath Spa University, King's College in London. And it was just about bringing us together, social workers, nurses, midwives, human resource people, business people, bringing us all together with a passion for the same topic. And we were going to look at how to keep people healthy while aging at work. And then COVID appeared. And we thought, well, okay, actually, this is going to be one of the greatest challenges to our health and social care staff. Let's see if we can look at that. So that's where we started in 2020. And you can see from this, what we were aiming to do was look at the impact of providing health and social care during COVID-19 on nurses, midwives, allied health professionals, social care workers, and social workers. And we were focused in, we started off really quickly. I mean, we really only started talking about this in March, April, and we were running the survey in May. So it all happened very quickly. It was rather mad, rather fast, but it felt very much like the pace that was happening with COVID. It was really gathering momentum very quickly, and things were changing very quickly for everybody. So we looked at, clearly demographics are very important, and we also use some clearly validated scales such as the Short Work Edinburgh Mental Wellbeing Scale, the Quality of Life Scale, the Brief Cope Scale, which looks at the coping mechanisms that people will use. But also very importantly, we also looked at, used the Clark et al. Coping with Work and Family Stressor Scale, because it became very clear very quickly that actually people were having to grapple with not just work, but being at home working, having to maybe be furloughed, be out of a job, lots of challenges that they didn't ordinarily have. Now, across the UK, we had 3,290 responses. That may not seem like a lot, but given the challenges that we were dealing with, we were pleased with that. It gave us quite a good overview of what was happening. The respondents were mostly female. The age bracket was 30 to 59. Among midwives, the age bracket was 30 to 49, so a slightly different lower demographic. Most of the respondents were in band 6. We did get a lot of respondents in band 2, 3 upwards. There was quite a range. Most worked in the community. That's for the general population right across all of the professions. Within midwifery, most of the midwives that responded worked in hospitals. And then some in the community, and the remainder between the hospital and the community. There were a number of key findings, and we sort of grouped them together just to try and help us look and see what were we finding. And very clearly what was bouncing out at us were changing conditions, the fact that people were having to deal with the whole safety aspects, the work routines, working from home, working different shifts, working in different environments, the redeployments issues, which were mentioned earlier. The work intensity, working too much and working too little, was quite interesting. That came up as an issue as well. And then that very important work-home life balance, and having to sometimes have work at home when people weren't used to having that, and dealing with children and schooling and all those great challenges, and perhaps also increased caring responsibilities to add into the mix. So quite a lot. The connections, it's clear, someone mentioned earlier about the connections and the importance of those connections, and how we all had to become very used to connecting with each other in different ways. And that was for just not only with employers, but also with our service users, and also with the public generally. And some of that we did actually ask a clap for carers question, but we'll talk a little bit more about that later. And communication, it was interesting that people felt communication was so important. I mean, we always talk about it being a soft skill, whereas I think communication is a vital skill. And it was really important that, you know, people felt that it was so important that the information that they got was right. And people did say that at times they got really contradictory information. They were given vast volumes of information, expected to wade through it and make sense of it. And it was very challenging for them. Whereas for some people, they actually found that they were very well supported. They were given key information, timely manner, and it worked very well for them. So there was lots of ranges of responses received. There was a sense of isolation for many, and I know that that was right across the age, the demographics, right? You know, whether you were working in healthcare, it didn't matter whether you're old or young, quite a few people suffer from that sense of isolation because there was that lack of connectedness, and that came through very strongly. Also, there was some frustration and demoralization, and that was to do with the lack of resources, to do with the challenges of working hard and not doing enough, about never seeming to get it right. So here are some of the responses directly from our respondents, and I'll let you read them for yourself. And Sue, I think has shared the presentation, so you can have a look at those. And within the presentation at the very end, there's a link to the website, and the full report is there. And it is accessible, and you can look at more detail on a lot of the information that I can't talk to you about tonight. I think the connections were really important. As I said, really, people were very worried about the service users. It didn't matter whether you were nurse, midwife, AHP, social worker, didn't matter who you were worried about the lack of connection with them, the fact that you didn't have that normal relationship that you had with them. People felt that they were, you know, worried about what's happening with those people when we're not connecting with them. And that was good to see. It was quite altruistic. It wasn't just about them as healthcare workers being stressed and under pressure. They were very worried about the health and well-being of the service users that they normally connected with. And as you see, one of the midwives in Wales was saying about the women changing their patterns of care because they didn't want to go to the big district hospitals anymore. They want to be seen more locally from a safety perspective. And that came across very clearly in lots of instances, not just for women. From the changing condition point of view, there was that issue about for the actual healthcare workers about being redeployed and the challenges and the stress of that, and that's already been mentioned. And that idea about safety, the whole idea at the very beginning where there were the challenges with getting access to PPE, appropriate PPE. You know, I even had my own experiences of having masks that had the expiration dates. If you expiration date, a new expiration date to put on top of the old expiration date, and you were thinking, is this safe? Is this right? Should I be wearing this? Is this going to protect me? All of these things that people were going through. We received some of the response talked about that, very much that contradictory information about not really knowing what they're being told and not feeling supported. Others felt very clearly supported, very clearly felt that their managers were doing everything that they could for them. And it was about good communication styles. It was about understanding their staff and what their needs were. So how did our staff cope? How did our health and social care staff cope? Well, across all of the professions, there really was a very strong move for active coping, very positive coping mechanisms. People did they accepted things, they tried to positively reframe things, and they tried to plan and really find humour. Actually, humour came out quite strongly as well. And nurses in particular, they scored highly on venting, and I laughed when that came out of the figures. The AHP scored higher in religion. Midwives scored quite high across all those very positive reframing, planning, being organised, accepting, getting on with it. And from a well-being point of view, it's interesting, the total well-being score of the respondents came out at 20.95, and that's about 2 points below the general well-being score of the general population. So for health and social care workers, there is that little drop in their actual well-being score. So that's something to be considered and thought about. And I suppose bring in the physical activity bit of that Jackie was talking about, and that may help address that. From an active coping point of view, clearly use of emotional support, recreation and relaxation, work-family segmentation, so getting that right, did predict higher work-related quality of life. So where you got your coping strategies right, where you used those very positive coping strategies, it did impact on how you felt about your work-life balance. There were no overall differences between occupational groups, age, gender, or ethnicity. Response from Northern Ireland and Scotland had lower work-related quality of life scores. Doesn't quite surprise me, but there you go. Having a disability and reporting sickness in the past 12 months predicted a lower work-related quality of life score, which is not necessarily surprising. And interestingly, for employers, a lack of preparedness for redeployment, so people feeling that they weren't properly prepared for that redeployment, did impact negatively on people's work-related quality of life. So looking forward, and as I've said, this is quite a run through, there's a lot more to it. It came out very clearly that the employers needed to provide flexibility around working hours and location. And there were many of the respondents who said that had worked very well for them. There were some who said it hadn't worked so well. Some staff were keen for more involvement, decision-making and autonomy. Some felt they were left out of the loop. They were being done to, as opposed to done with. Connection with colleagues and managers was very important for many of our respondents, and that could be done in any way. And the visibility of management, either in person or virtually, was also seen to be really important. Skills training and preparation for redeployment, as I've said, that's really important one for employers to consider, trying to preempt that idea about redeployment, trying to anticipate what do we need to put in place. I know that's sometimes not possible. And then that general health and safety at work. As I've said at the very beginning, the PPE may have been an issue. I think there are a lot less issues with that now. Well-being and taking leave, it was important that however busy things were, where possible, people needed to have their breaks and to have break away from work and to have their leave. So that was really important. So that brings me to the end, a very quick fly through. Looking forward to this year, we're actually in the middle of our next survey. So anyone who still who would like to take part, we'd be delighted. Whether you're a nurse, a midwife, AHP, social care worker or social worker, very welcome. The link's there. I know Sue has put them up on the site as well. And we did get the survey translated into Welsh as well, so it is available there in Welsh. And the HSC Workforce Study website is there, and you can get the full reports there. And we have already undertaken some focus groups to follow up with managers, and we're doing next week, I'm doing some with frontline staff. If you'd like to get involved in that as well, please feel free. Thanks so much.
That's fantastic, Patricia. Gosh, edited highlights.
Absolutely.
So and anyone who's been involved in any research will know that Patricia was set a difficult task to just sum it all up. But of course, one of the important things is to look at the research yourself, have a look, share with your colleagues, but also look at whether you want to be involved in the next bit of it, which is really important as well. So thank you so much, Patricia, for sharing that. Thank you. I think I might have another invitation for you coming along. Now, I know that we're very short on time now, and I've had a couple of questions from the audience. One is from Mala, who's quite often comes, so hi Mila, and another one from Susan Vining, who also is someone who comes a lot. Both of them want to know more about Mummy Star. So I think if I can ask Pete to maybe answer this online afterwards, yeah. I think that might work better.
No problem.
And I hope that's okay with everyone. I think there's a few questions coming about the vaccine, but I think that will need to be online because we have run out of time. And I wanted really to also highlight the top 10 Maternity and Midwifery Hour episodes, and just say to you, they're on the website as well. Worth going to see if you can see if you've seen all of the sessions. So the top one is COVID-19 and infant feeding. And the second one down is midwifery students stepping up. Sickle cell and blood disorders is number 3. And 4 is dismantling racism and inequalities in midwifery education. So there's a really good sample of things. And in fact, I wouldn't be able to choose my favourite because they've all been fantastic. And this evening has been fantastic as well. I've been so honoured to have my colleagues here sharing their knowledge and their skills. I set them a difficult task, which was very mean. I'm sorry.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.